Lane, thank you very much indeed. And what a pleasure to be here, and what a great scene as well, seeing all these faces. And I was quickly scouring to see if I knew anyone. And I have to say that one who's popped up and probably trying to be quiet in the background because he hasn't got his picture on is Rob Fairbanks from Surrey Hills. So Rob was the one man who made all my life change, because I phoned up the Countryside Commission, as it was then, to ask about whether they might be interested in funding a strange little idea of health walks, which was going on in my practice. And Rob, instead of saying, thank you very much, but no, we do countryside and we're doing nature, said, oh yes, health and nature, that would be a really good thing to get together. So Rob, thank you very much, wherever you are on that big list, because you really, and forevermore, I'll be grateful for you for getting this started. And that was back in 1994. So it shows how old I am and how old Rob is as well. So, but we're here and it's really exciting. Things have really moved on since then. I mean, it's extraordinary that given that time, it was completely out of anyone's kind of idea that nature and health should be taken seriously. Everyone knew about going outside and getting fresh air, but the actual idea that it could actually change your brain, inequalities, sort out health problems was completely off the curve. So now we know it very differently, and I'm really impressed with what's been happening with the network here, because you really have got what I think is what's needed is to make it actually happen. So I'm going to share my screen. This is always a sort of moment where you hold your breath and just hope it's going to work, and let me know if
yes, William, we're okay.
Does that work as well?
Yes, it's fine.
Yeah, because sometimes when it goes into presentation mode, it does something weird. But that you can see Nature Health Network, 19th of January. Many of the things I've talked about for all that time haven't really changed. So you'll see some slides here and you think, oh, if you've heard me before, you think, oh, he's going on and on about the same old thing. But that's because it's a very simple message. So if we remember, we are human beings and we used to be hunter-gatherers, and therefore we're actually programmed very simply as our factory settings going right back to 200,000 years ago to be sociable, to be in a place where we feel nurtured and comfortable, and to have a purpose in our life. That's it. That is pretty much the fundamentals of all health. You have to have that social network in the pack of the hunter-gatherers where you feel connected, you feel supported, you feel that you've got that interaction and that constant interaction, which is why it's so difficult at the moment in lockdown. And if we look at the 5 ways to well-being, which are kind of shoehorned underneath, that's the connect bit. The place has to be nurturing, it has to be supportive, and it has to be something we really, really get to know and feel we belong to. And obviously this is the purpose of today's talk and why we're here. And that mostly is nature. It doesn't have to be. You can be in beautiful buildings and feel very connected. A lot of beautiful buildings are actually built on fractals of nature and ratios of nature as well. So we've copied nature all the way through. And that in the 5 ways to well-being is taking notice, where it's the here and now. You look up and you see the sky, and you see the clouds, and you see the weather, or you see the rain as it is up in Yorkshire, or you're looking around at the little trees, the little plants, the window boxes, everything. It's really taking notice of the first bird song. We all remember the lockdown in April, where the joy for, I think, for a whole new mass of people to connect, which they hadn't done beforehand. And finally, you have the purpose, which is important because that means you feel you belong. And that's where nature has an effect. But being active, giving, learning, feeling you've got autonomy, in other words, you've got control over your life. And if you look at the middle one, nature, actually it connects both those other two as well. So nature increases sociability. We know that people who meet where there's grass and trees were more likely to say hello and feel less intimidated compared to if you meet someone in a concrete area or where there's no nature at all. So the hostility of our environment actually impacts how we connect with each other. And on the other side, if you really feel you belong to a place and you know the nature, you feel special, you feel that you belong. Nature the universe, the world, knows you're here, and you feel that kind of sense of almost security. And a lot of teenagers, when they're going through really difficult times, will tell you that the place where they found their solitude and their kind of recuperation was down in nature, by a tree or by a stream or somewhere. So that's where we're meant to be. And if we get all of that right, and we get that place bit right, that's our resilience. And that resilience is really important. And if we have that resilience, then stressful events that come along get bounced off. We can cope with them. And that leads to active lifestyles, healthy diet, satisfaction, happiness, etc. But there is a kind of theory called the human mismatch hypothesis, Professor Lee, and it's quite there's quite a lot to it. But basically he said, well, look, we were hunter-gatherers, and we've got this ideal environment as a hunter-gatherer, which has been hardwired into our brains and into every part of our body. And that had to be shelter, it had to be wildlife, it had to be a visual ability to look for enemies, there had to be fruit, there had to be berries, and there had to be all sorts of things, and water. And if we have all of those things, we know we're safe. And that ideal environment is how we've been hardwired for the 200,000 to 300,000 years. The environment that's changed is that we now have this new environment, which is completely opposite to the environment that we have been programmed. Now, if you imagine we're an animal and you're putting a zoo, if you put an animal in a zoo and it had that kind of environment you can see in front, that animal's not going to be very happy. It's going to be quite stressed, and we're no different. So although that environment is quite common, it actually is causing a huge amount of underlying stress without us perhaps even realizing it. And I mentioned before that when you meet people in an environment like this, you're far more likely to not say hello and not interact with them. And that's evidence done in Chicago from back in the 80s, compared to actually if you were in a tree-lined area. So you've got this ideal environment and you've got this new environment. And what we're saying is the area of mismatch is all this new area where there's no connection with the ideal environment. The bit in the middle is where we still have both together. And what we're trying to do now is to put as little as possible in that area of mismatch where we feel it's really bad, and push it so that that intersection gets bigger and bigger, that we'll never go back to our ideal environment without houses and cars and things. That's impossible. But we can increase that intersection of having parts of the ideal environment in harmony with the new environment. And that is where we are aiming, the area of opportunity. And I've used this slide for a long time, since I was at Natural England, and it's just a good emphasis. It's been reproduced now in Ireland, and it's been reproduced in quite a few countries now. But it was one family in Sheffield. And what this area of mismatch is showing is that when the guy on the bottom right, which was Ed's great-grandfather, was able to walk around 6 miles in 1919 as a child, and actually could roam around in the countryside. And Ed's dad on the bottom left, his grandfather, could roam about at least 2 or 3 miles and go in woodland and be back by tea. Ed's mum on the top right in the 1970s was able to cycle to the swimming pool and back again, but pretty much was already, her world was shrinking. And Ed, of course, is the 300-meter child, and many children now are locked in and can't go out anywhere. So if you look at that area of mismatch, we are actually reducing that area of opportunity by pushing children further and further into that area of mismatch, which is indoors. And the indoors is not where we're designed to be. You can make indoors as good as possible, but it doesn't ever replicate the outdoors and the exploration that Ed's father, grandfather, and great-grandfather had. So let's have a look and see what's happening now. So we've got loneliness, so we've got people isolated. We've got a hostile environment, which is either completely indoors or it's where there's very little nature, and people don't feel they've got the control, with trust in governments, trust in other people around them, don't feel they've got control because IT is taking over, and they feel that their autonomy is gone. that means your resilience has dropped, which means that the stressful events can now get through and impact you because you haven't got that impact and you haven't got that protection anymore. And that creates this chronic stress. Chronic stress is very different from acute stress, which is normal. Acute stress is the immediate stress when you are going for an exam or interview or something like that. Chronic stress is you wake up every day with this constant feeling of being out of control. And that creates stress hormones like catecholamines and glucocorticoids, which are the cortisol, which cause the body to change. Now, in acute phases, they bounce up, cause us to have a fight and flight, and then go back down again. But when it becomes chronic, you get things like noradrenaline coming in, which creates anger and aggression. You also get cortisol, which turns from being an anti-inflammatory, because things like dexamethasone for COVID and prednisolone are anti-inflammatories. They're used all the time in medicine. We use it all the time. But when you become chronically stressed, that cortisol switches from being an anti-inflammatory to being an inflammatory problem. So what happens then with chronic stress? And if you look on that left again, remember that place, having hostile no nature and pollution around you, can create this chronic stress by reducing resilience. You get coping mechanisms. And our coping mechanisms aren't brilliant, but they're very much based on our historic ways of dealing with things. Inactivity, poor diet, addictions of smoking and drinking just to numb the area, and poor sleep. So let's have a look now as we move along what happens to all of those things. And I'll just go back to the inactivity and poor diet in a minute. But what happens now is that if you're inactive, you increase what's called your inflammation, because the cortisol now is now inflammatory, and other things are going on, which is about your mitochondria as well. And your immune system is getting in on the act and saying, look, this is not good. I'm meant to be all happy and everything's fine, but things are not fine anymore. Therefore, the immune system is geared up a level. And when the immune system is geared up a level, it starts to attack your own body. And that is not so much always the autoimmune conditions, it's a chronic inflammation of the body being slightly under attack from your own immune system constantly. And the cortisol is doing it, the adipose tissue in your gut is doing it, because that is actually causing your body to kind of have an inflammatory reaction. So your whole immune system is now being changed, and that causes all problems on all of those conditions there. The obesity, the lung can get a problem, you get faster aging, your bone gets osteoporosis, your muscles go thinner, so it's called, you get much sarcopenia, your skin becomes thinner, your brain affected hugely by depression, anxiety, and also dementia, all caused by this chronic immune system. The heart was the first discovery that this was an inflammatory condition rather than just being a kind of blockage of cholesterol, that the vessels in the heart become inflamed, and that causes the atheroma and therefore the heart attack. So cardiovascular disease is purely an inflammatory disease. And so is, going back to the brain, about 20% of all depressions are inflammatory, and anxiety is about 50% is inflammatory. And then the metabolic is the diabetes. So that becomes inflammatory. So now you can see the pathway where if there's no nature and you're in a hostile environment, that can actually increase the sense of loneliness, and we'll come on to that. That can absolutely create a lack of purpose or sense of belonging. That reduces your resilience. It means that the normal stressful events come to you and they hit and become chronic stress. It changes your entire body. You try to change your activities to try and cope, and we'll come on to that. And that leads to this immune system going up into chronic inflammation and short telomeres, which I mentioned, and then that affects the whole body. So it's not isolated. All of this is connected, and that's pretty much health in one go. And you can see everything's all interconnected here. And place can go straight to the immune system with pollution. So air quality can have an direct inflammatory response from the lung, which then goes to the rest of the body. So we've got these three things causing this chronic stress. Chronic stress goes to inactivity, poor diet, obesity, and smoking, and then that goes to the chronic inflammation. And if we look, we've just looked at some of those things, we can see chronic inflammation starting in children as young as 6 years old. So this is something which you can measure from something called IL-6 or CRP, and that actually causes, it goes up, it should be under 5. A very low grade inflammation means it's between about 6 and 8 or 6 and 7. If you get an infection, that whizzes right up. But we can start to see people, particularly if they're overweight, where the adipose tissue is causing this chronic inflammation in people, and that causes all of those conditions. So we can start to see why this country and the rest of the Western world are having these problems, because most of it is caused by this chronic inflammation, and most of that's caused by chronic stress, and most of that's caused by the way we live, because we've got this mismatch. Just on a quick thing, if you've got a sedentary person and they are stressed and they're not eating good or eating too many things, then what happens right down in the body, in those cells, you've got these little mitochondria, which funnily enough used to be single cell organisms that used to roam around in the sea. And one day they jumped into another cell and that created life, and life has carried on, and we've kept them. And they're called mitochondria. They've got their own DNA, nothing to do with our DNA. So they're still like little organisms, but they are part of us now. So this is how our body is a bit of a hodgepodge of all sorts of things. And that they create all the energy for our body. They're the best batteries, and every part of life has got these little things in them. And when you've got a sedentary and everything's going wrong, then when this starts to become charged up like a battery, you can see the red ring around it, and then it just can't hold that charge, and these electrons leak out, just like if you overcharge your phone or you have a battery that's overcharged. You just find that it gets warm, and therefore that is about electrons. So you're knackering the battery basically, and you knacker your own mitochondrial cells. And if you absolutely cause that problem to too many of those mitochondria, then the cell can no longer survive and you start to age more quickly. When you're active and when you're not stressed and when you're eating well, then actually you find that you don't have these electrons, and your antioxidants build up, and then you get more mitochondria and the cell becomes really healthy. So you can see right down at the very, very core of our body, right into the cells, right into the cytoplasm where these mitochondria are, that this is going on constantly. If we're just eating junk and sitting around feeling stressed, then this is constantly creating these free radicals, or electrons as you might call them, which causes this inflammation. And what's more, those go to the end of the chromosome, those free radicals, and they knock off the ends of the chromosome called telomeres. And telomeres have got a very strong association with length of life and disease. So the longer the telomeres are, the more likely we're going to live a longer age. The shorter the telomeres, the more likely we're going to have a shorter age. And you can actually have them measured. They are quite dynamic, they do move around, but the one thing that really helps those telomeres grow is actually being active. And physical activity tends to make those telomeres grow longer because they increase an enzyme called telomerase. But the more free radicals you have from that bad situation, the more likely you're going to shorten your telomeres. And children can actually be shown to have shorter telomeres. So let's just go back, Jen, to this whole thing about chronic stress and our coping mechanisms. So we've now shown that nature, or the lack of nature, reduces our resilience, therefore more likely to get chronic stress, and therefore you're going to find that you become more inactive. So inactivity and chronic stress are strongly related. We all know that. How many times have you gone through a stressful time in your life, and all that work of going to the gym or doing your own work or going for runs or going for walk, they all go by the board. You haven't got the energy, you haven't got the motivation. Your brain is focusing on coping with the stress, and that's what your body's doing. It's coping with the hierarchy of need. It's a higher need to deal with this stress and deal with these problems, because that's impacting your survival. Therefore, peripheral things like going for a run is expending unnecessary energy, and therefore you're going to be less motivated to do it. And then obesity, and when you actually become stressed, you produce a hormone called ghrelin. Ghrelin then goes to the brain. It comes from the stomach, it goes to the brain, and it tells the brain, eat, eat, and eat. Eat calories, eat sugar, eat fat. Keep going. Because what you're trying to say here is, let's get as much energy on board as possible, because as a hunter-gatherer, if you're about to go through a stressful situation, you want as many calories on board as possible, because you've no idea if there's going to be a war, a disease, famine, you're not going to get any water, or whatever it is. The body doesn't quite know what it is, but it knows that when you're stressed, you've got to get those calories in. And those calories are stimulated by ghrelin. And what's more, it says, let's store those calories. There's no point in burning them all off. So let's store those calories as visceral fat. So if you all look down and you see a little bulge in your tummy, which you don't particularly like to be there, that's your fat in your tummy. Deep inside there is your visceral fat. And that visceral fat is your pouch, your storage of energy. It's there because it's there to be used for the next few months. Unfortunately, we don't get rid of it. And if it stays there for a long period, it starts to become almost an enemy of the body. And that causes loads and loads of inflammation, which is why this chap here would have a high CRP and he'd have more inflammation. And that inflammation is more likely to lead to diabetes, to dementia, to heart disease, to all of those things that we've just talked about. Now, interestingly, people are getting clever in the research now. So in this study, and this is 2016, so it's 5 years now, but when we do green exercise as opposed to gym-based exercise, we find that the telomeres are having a better profile with increased telomerase. So green exercise, therefore, must mean that although both are doing physical activity, that there's more interaction with other people and there's more interaction with the environment, and you're outdoors, therefore you're less stressed. And therefore the likelihood is that that reduction in stress and that interaction with nature and other people create a better environment, means that your body feels more comfortable, therefore you have less free radicals, and therefore you actually increase your telomerase and your telomeres get longer, compared to indoor gym where your stress is probably still there. So this is a really interesting factor. You've got green exercise now proven to go all the way down that pathway we've just done, and it measures the other end and they show that it's actually got better aging profile. Even of children, public green spaces of children being outdoors was associated with longer telomeres than these children. So again, children who are outdoors of free play with green space appear to have a better profile of their telomeres, and telomeres, as we said before, reflect how long you're going to live and also reflect how much disease you're likely to get. And therefore, if you're a child and you start with longer telomeres, your prospects for life are much better, and you're less likely to get those things of obesity and diabetes and dementia and depression and those other things. And the other thing is your hippocampus, which is part of the brain that does behavior and learning. Rural children have a higher level of or greater volume of hippocampus and compared to urban children. So again, they're parts of the body that actually start to develop better, because we're going back to that area of opportunity, or even before that, that area where we're our ideal environment. And that ideal environment, if we have that, we start to see what our body should be like, not what it's become. I mentioned about people not seeing each other very much when it's a hostile environment. Well, this study showed that the perception of loneliness was greater in places where there was very little nature. So perception of loneliness and feelings of loneliness with less social support. And they tried to adjust, as with all of these things, as much as possible with other factors that could be accounting for this, but the association was very strong. That green space seems to improve the increasing social network of people. And also the perception of health as well, that people feel healthier. And that's a really important thing. Perception of health is a really strong, important thing. It was thought to be kind of unimportant, and it was objective health that was important, but perception of health very strongly means you're very likely to get less disease. So this again with green space and within 1 kilometre. And the inequalities, and I'll just quickly, because we're just going to be finishing now, but I just want to go through this because it just needs a bit of explanation. It came up quite a long time ago. I think 2008 now. So, you know, this is over, I remember when it came out, it was a big study, but let's just have a look at it. So you've got 3 colors there. You've got dark blue, middle blue, and light blue. The dark blue is those people in the lowest economic status. So they're the ones in the lower social demographic groups, the poorer people in more deprived areas. And the ones in the light blue are in the highest areas of affluence, so the least deprived. And on the left-hand side, that incidence rate is death. So it's done on millions of people here. So the higher it is, the more chances you're going to die. And the lower it is, the less chance you're going to die. And then on the bottom, there are 4 groups. One is little green, one is some green, one is more green, and one is very green. So they looked at the areas around where people lived, and then they obviously adjusted all of this with the socio-economic things as we've seen here. And what you can see, if you go to the little green, you see that there's a huge disparity between those people who are affluent and those people who are in deprived areas. And that is our dreadful health inequalities that we've got, which Michael Marmot has been pushing on for so many years. That dreadful gap between 1.2 incidence of death and almost 2.2, so it's almost double. But as we get into more and more green, you see that that level, that gap drops. So people living in very green, the most deprived person is now 1.4, just above, and the least deprived has actually gone down to about about 1.1. So you can see that actually it's gone way below. You've crushed the inequality gap. And if nature is able to do that by having more natural environment in places where people are living in the very high deprivation, then you're already closing that gap without having to do anything else. So we don't know about the interventions, whether they'll do what it's showing on this graph, but certainly that's where we should be aiming for, to try and increase the amount of every person should be able to live in a leafy suburb. There's no reason why that's not just the affluent. So where we're looking at health has to be the person, which is what I do as a GP still. I'm still practicing as a GP. The place is now as important, and the community, which we've known about for some time. And health has to sit right in the middle of those 3 areas. I will push to Green Gym. There we are, Green Gym from TCV. And that's an area where if you think about what Green Gym are doing, it's getting people outdoors to do conservation work. So yes, people, strong social networks, tick. Place, feeling safe, secure, connection to the neighborhood, the nature, all the area. This is in your local area, tick. And purpose, huge sense of purpose when you're doing conservation work. You're learning all about the natural environment where you live. Many things you didn't know. You know you're doing good. You've got a role. You've got a purpose when you're doing it. So the more things we can do where we can go tick, 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 then we know that actually that is right. And when we look at things which are app-based and going through on IT, is it increasing social networks? Is it making people connect to their place? And is it giving them that sense of purpose? So we've got to ask that question. I'm going to promote a book, the Oxford Textbook of Nature and Public Health, which I edited with Matilda van der Bosch, who some of you may well know. She's now at University in Barcelona, professor. And that really does have now as much of the information we've got about nature and health and how that connects together. And then finally, my other role is as CEO of Intelligent Health, which is a company where we deliver Beat the Street, which is to get whole neighborhoods, whole towns in deprivation out into nature and connect. And we get school children to get their families and grandparents, etc. We've reached over 1.3 million people who've taken part in this now. And this next 4 months, 234,000 are now destined to do this in areas from Sheffield, Rotherham, Barnsley, Derby, Wokingham. All those areas are going to be now pushing for the Beat the Street. So this is what I'm trying to do in a practicality, using gamification and a little bit of IT to get people out into nature, connected to the places where they live, because we have to get people to take that first step into nature and get them from indoors. Thank you very much. Thanks, Lane.